Aloha guys, Dr. Thomas back. Yes, we're picking up where we left off on chapter 11, slide 24, Roman versus Roman. All right, what this says, guys, is if a married couple had frozen embryos, frozen fertilized, or perhaps even semen samples frozen, that after the divorce it had to be destroyed. Why? All right, I'll tell you why. Imagine that Dr. Tom had gotten divorced and that I had frozen sperm or already a frozen embryo. And a year or two down the road, the ex-Dr. Walker's wife decides she wants another kid. And she has it. And then she comes to me wanting child support for the next 18 years, several $100,000. Can you see where that could be a real problem? What if over the next 4 or 5 years she had 4 or 5 youngins just for that reason? Yeah, okay. Do I need to say any more? Has it happened to me? No. I just had to pay a lot of child support the old-fashioned way. Unborn Victims of Violence Act, let's see, became federal law in 2004. Crime to harm a fetus while assaulting a pregnant woman. Okay, so they're saying, hey, if you attack some lady, you rob her, and she's pregnant and the fetus is harmed in it, then that's extra punishment. 38 states have fetus protection laws. Case law and many others hold a stillborn child's estate may seek recovery through wrongful death and survival action for injuries sustained while in the womb, and others because you're attacking her, made her have a miscarriage. And it should. Rights of newborns. Fixated newborns means it's been cut off from oxygen, but other than that. Down syndrome, obstructed digestive tract newborns. Okay. Down syndrome, guys, is what I was trying to think of earlier. They often do amniocentesis in middle-aged mothers because they're at a higher risk to have a Down syndrome child. And they can easily examine the chromosomes and see if that's the case or not. And you kind of have a choice how you want to proceed with it. But fixated newborns. They all newborns are fixated during birth. Like maybe the umbilical cord got wrapped around their neck. Baby's dying condition did not meet the criteria for brain death. The Denver team waited 75 seconds. The infant who received the heart lived. Any congenital defects present? No, you can donate organs. Dilemma. How long after ceased brain function can the organs be transplanted? Well, it depends on how long they're deprived of oxygen, guys. And that's another issue we'll talk about another time. This has to do with a baby that's asphyxiated during the birthing process and they know it's not going to survive and how soon they can get in there and take its organs. Down syndrome, obstructed digestive tract newborns. 1982, baby Doe, Bloomington, Indiana, born with Down syndrome, obstructed digestive tract. Parents refused to consent to surgical treatment. Hospital took the case to Superior Court. Conclusion, parents' responsibility to choose without interference by the government. The child soon died. Excuse me. This is fairly complicated stuff, guys, and I don't know. I'm surprised they ruled in that regard. Baby Doe influence, one of two, let's see. 1985, Department of Health and Human Services. Public policy behind these regulations prevents withholding of medical care from an infant with one or more non-congenital anomalies by defining the withholding of medical care as neglect. It's trying to control, guys. In other words, if an infant is born a neonate with very significant problems, how much effort do we need to put in to keep the poor child alive if it's going to have an extremely impaired life? There are 3 exceptions to the policy: when the infant is chronically and irreversibly comatose, when treatment would merely prolong dying, when the treatment would be futile, either because the child would not survive or the treatment would be inhumane. Apparently, they ruled that the child does have to be treated unless they have one of these 3 or these 3 exceptions. Okay, baby doe influence continued. Federal legislation requires each state to establish programs and/or procedures within their child protective services system to meet needs for treatment by disabled infants with life-threatening conditions. HIV testing for pregnant women. In 2014, there were approximately 45,000 new HIV cases in the United States, which is a 19% decrease compared to 2005. That's promising. Drug therapies for preventing mother-to-child transmission of HIV reduced infected babies born in the United States to fewer than 200 a year. Fantastic news. Same topic. Let's see. Most HIV-infected babies born in the United States have mothers unaware of their own infections. There's a stigma of the test. Children infected with HIV with no symptoms. Physicians fail to diagnose HIV in children. Has this become an ethical dilemma, placing a baby's rights to medical care against their mother's right to privacy? Well, it kind of sounds like it. That's something to think about. Teenage treatment decisions. 16-year-old cancer patient who no longer wanted treatment. Physician's ultimatum: continue treatment or face death. Teenager refused and wanted homeopathic, which is sort of an herbal type treatment. Instead, the parents agreed. A year later, the cancer was gone. Apparently, well, it was either one thing. It was either spontaneous remission by extreme coincidence, or the homeopathic remedies worked. Which one do you think I think? That's right. I know for a fact that sometimes alternative treatments work and work better. Ethically, is the right to be forced to undergo treatment against his will because he's underage. See, if it was an adult, there would be no question. Legally, teenagers unable to make the treatment decision. Parents went along with it, which is good because probably the kid wouldn't have survived if he hadn't have. I know what you're thinking. You think, well, Dr. Tom, homeopathy is quackery. It's not supported by research and used for cancer and all. Yeah, but there's a lot of alternative treatments that are, guys. I've been an alternative practitioner my whole career. A lot of them that work well. Treating children's behavior issues. Many ethical dilemmas in current practice of psychopharmacological treatment of children. In other words, for mental and emotional problems. One controversy is the use of drugs versus use of more traditional counseling and therapy for children. Healthcare industry determined to cut costs. Drug treatment over counseling. Is it ethical that managed care dictate the care that today's children receive? Well, I'll answer that. In my opinion, absolutely not. Managed care is an insurance company, guys. They have no right deciding what medical treatment a person is going to receive because they're going to choose the cheap way. I'm not sure about this. What this is saying, and we've actually skimmed through and finished this in the 7 minutes we've been doing it. Do we rely on just giving the kids meds like Ritalin and things like that? Or do we actually try to do something about the problem through counseling and things, which ultimately take up a lot more time and are a lot more expensive? So there is a tendency, guys, within the medical field, in my opinion, I've been in the field a long time, to over-medicate, over-prescribe, to try to do everything with pharmacology. In many ways, that's great stuff, and it saves lives around the world every day, but it's also overutilized, and that's an example of what they're talking about here. Okay, we finished chapter 11. We went through it quickly. Yes, again, this is not my area of expertise, although I have some experience and I've taught this class before. Read over the book, get a feel for it, but what this is all about is basically technology and medicine and all has advanced in science so far that we've broached over into these areas that have to be considered for ethics and all too. And it's very interesting, very much so, yes. Okay, Dr. Tom's going to sign off. We'll come back with chapter 12. Be there and be square. We'll see you shortly.